Morning, everybody. Welcome. Are we ready to get started? All right. I'm going to take that as a yes. Thank you so much for joining this morning on this third and final day of the City Match Conference. I hope you all have been enjoying it as much as I have. There have been so many rich sessions. So thanks to City Match for all your hard work and pulling this off. My name is Amy Mullenix. I'm with the National MCH Workforce Development Center. I have a group of friends and colleagues here with me today from the Workforce Development Center. We're excited to spend a little bit of time with you this morning. I'm the collaboration manager at the center, and the center is housed at UNC Chapel Hill as the academic lead for the Workforce Development Center. And then our practice lead is MCH, who I'm sure you're all familiar with. And we also have Jess Simon from MCH with us today. Kristin, if you want to go ahead to the next slide. That's a picture of who we are. We are looking forward to spending this time with you this morning. And we will each introduce ourselves as we come on camera for our piece of the puzzle. I also just want to warmly welcome you and let you know that this is a skills builder session. So we're really excited to be able to put folks in breakouts a little bit later on and just get your hands a little bit dirty with the with some causal loop diagramming. Hopefully that sounds exciting. It's nothing hard. It's not a heavy lift, but it is a chance to practice really thinking about, hopefully it will be useful for you to get an opportunity to sort of process COVID in your own context and think about what COVID has meant for your own system. So we're looking forward to doing that with you today. Kristin, will you share the next slide? All right, before I do this, I do want to do a land acknowledgement. So those of us who are at UNC Chapel Hill want to acknowledge that UNC Chapel Hill sits on the ancestral lands of the Occaneechi, Shakori, Eno, and Sissipaha peoples. And long before our campus existed, there were teachers and students and elders and youth that inhabited the spaces that we enjoy today. I also wanted to share that UNC recently renamed our Student Affairs building in honor of Henry Owl, who was a Cherokee historian and activist. He was the first American Indian and person of color to enroll at Carolina, where he earned his master's degree in 1929. So the context of land acknowledgement is particularly important for this session, I think, because we're really thinking about the disparate impacts of COVID, and I'm sure you all have witnessed the disparate impacts of COVID in your own settings. So we're really wanting to connect that with the history of our country and our places. Just a little bit, we only have one slide about the Workforce Development Center. We have been around for about 8 years. We are funded, like City Match, by the Maternal and Child Health Bureau, and like MCH as well. So our charge is to deliver training and consultation, particularly in support of Title V professionals and their partners. You may, as local health department folks, have partnered with state teams in some work with the Workforce Development Center. We focus on change management, adaptive leadership, systems integration, and evidence-based decision-making and implementation. All of our services are really sort of foundationally built on family engagement and health equity. Today, we're going to really focus on a systems integration tool. We're going to talk about systems thinking and how that might be practical for you in your work. Next slide. So we wanted to share a little bit about what motivated this session. Obviously, the COVID-19 pandemic is a giant health crisis. Hopefully, it is the biggest health crisis we will face in our lifetimes. But thinking about it from the view really as public health practitioners, we all know that the impact of COVID-19 is extending beyond the actual health outcomes that are directly caused by COVID. You all know that better than anyone in local health department systems, sort of the ripple effect. So our session today was motivated by giving you all the chance to think about that and sort of slow down in an intentional way. Think about how the system ripples have impacted your work and what you might want to do about that. So Challenges are always an opportunity to learn and to innovate. So hopefully this session will be useful in your thinking about that. And with that, I'm going to turn it over to Dorothy Cilenti, who has a local health director perspective to provide.
Thank you, Amy, and welcome everyone. I want to add to Amy's greetings from the National MCH Workforce Development Center. My name is Dorothy Cilenti, and I am at the Workforce Development Center at UNC. I work in the Department of Maternal and Child Health. But since February, I've had the opportunity to work in Wake County Health and Human Services in their public health department as an interim public health division director. As you know, there's been a lot of turnover, retirements, resignations, and so I had some previous local health director experience and was available to fill in while they recruited a new director. So that gave me some firsthand experience in the COVID pandemic, and have been witnessing the workforce challenges as a result. In a large urban health department like Wake County, many of the staff were redirected to COVID operations, and then many new staff were hired either through contracts or directly. So there's been a lot of organizational change, system level change, but there's also been impacts on other areas of public health. As you know, we've seen increases in opioid related deaths. We've seen increases in syphilis, gonorrhea, congenital syphilis. We've seen chronic illnesses that have gone unmanaged because of a lack of access to preventive health care and medical management. So we appreciate that you are all continuing to work in environments that are unpredictable, demanding, and also challenging to recruit people to do the work during this time. One thing I would say is I've noted that COVID illness is both a health outcome, but it's also a contributor to worsening disparities for other health issues, as I've mentioned. And so we've been fortunate in Wake County to get some funding from CDC and the Office of Minority Health to do more community-based partnering to address the disparities, particularly among populations that are less likely to be vaccinated or tested, or more likely to be in work settings or school settings where they're exposed to COVID. So it's been a real opportunity, as Amy said, to build new partnerships and think about how to sustain those partnerships even after we're no longer focused on COVID. So I'm really looking forward to this session and your participation. We really want to hear about some of your challenges in your communities. So with that, I'm going to review today's agenda. If you could go to the next slide, Kristin, thank you. So we think it's important to provide you with a general introduction to systems and systems thinking. And so you'll hear some of the foundational content related to the science of system dynamics. You'll have an opportunity to learn how to use causal loop diagrams as a way to tell your stories. You'll have a fun time creating and sharing your own story. So you'll be giving an opportunity to draw your own diagrams. And then we're going to share ways that we can use systems dynamics more generally in the field of maternal and child health and public health outside of COVID in particular. So thank you again, and we'll be available throughout the session to help you and interact with you. So I'm going to turn it over to Kristin.
Great. My name is Kristin Hassmiller-Lich. I am on faculty in the School of Public Health at UNC, and I lead the systems core with the MCH Workforce Development Center, and I'm really excited to be here with you today in this important session. I am so excited to really help, bring this tool to help us tell stories, tell our rich stories, and learn from each other. So let's get started. I encourage you to open up chat, and as I go through these 10 minutes of slides here where we kind of level set on vocabulary, drop ideas that you have as you're processing this information to share with each other into chat. So I want to start out by talking about what is a system? How do we think about a system? I think 10 years ago when I asked this question in sessions like this, I'd often get the answer that it's something that I can draw, it's an organization that I can draw an org chart for. But I think we want to push ourselves to really think much more broadly about what a system is and how to strengthen them. So we encourage this real broad definition. A system is a collection of parts that interact with each other to form an interdependent whole, right? And that interdependent whole is producing outcomes that we care about. We'll get to what those parts are, but I want us to think very broadly about those parts, what they are. They could be people, organizations, they could be factors in the environment that influence what happens. Okay. So examples of systems, not just an organization, a watch. A watch is a system made up of gears and materials that work together to help us tell time. Hopefully it is functional and it keeps us on time. A family is a system, right? And it could be a family in a household, or it could be an extended family that the boundary is bigger than that household. That is a system that's working together to navigate the world, to be economically stable, to protect one another. Lots of different outcomes. A state health department is a system that organizes resources, activities, and people to promote health, and how we work across organizational boundaries is also a system. We're probably working in multiple systems as we work to protect maternal and child health. Okay, so just again, to keep pushing our thinking about a system, what does the system look like that shapes outcomes for children with special healthcare needs? What are those parts? Well, we have components or parts of the system that include people. And those people might be pediatricians, teachers, parents and caregivers. Type into chat other examples of people. Who has a role? Who has a role in the system that supports the health of our kids with special health needs? Schools, right? Right. Police, care programs. I love this, right? We want to think really broadly because it's more than just one person. And the more broadly we can think about the components of our system, the more we can bring people together to understand and try to improve that system. Managed care organizations, public health systems that provide policies and services, great, right? And the who is probably going to vary community by community. And we want to make sure that we're bringing the diverse who into these conversations. So we also have parts of the system that aren't just people or organizations, but other components like the laws that we have that shape what happens, financial resources that are available, cultural norms. We also have factors that shape the kind of connections, how these parts come together. And so here we have things like, whether or not there's a shared vocabulary, goal alignment, the extent to which that exists, whether we have warm handoffs between the programs and services that our families are eligible for, the extent to which we have trust between patients and providers. So when we talk about parts in a system, it goes way beyond people, right? The people in the org chart, it goes way beyond that. And systems thinking, what we're building up to, is really all about trying to appreciate what these are. Continue to drop ideas into chat. What are some of the other components or parts in this system? Insurance access, family leaders, family support groups, great. Social economic status and all the factors that affect that, right? Great, right? So system thinking is about trying to see the big picture, start to think about the parts and how they sit together. So what does this work look like? How do we start to, brainstorm and start to see and study systems? So let's talk about the iceberg framework. This is one of our really important frameworks. I think it's a really nice metaphor for what we mean by systems thinking. Often we spend a lot of our time seeing crises, events, fires, and needing to quickly react to them. We're hardwired as humans to do this, right? Fight or flight. We've got to get things. We've got to keep ourselves safe. We've got to get things done. We've got to be efficient. But sometimes, and maybe more often than I think we do, these events, these fires, they are just, we're just seeing the tip of the iceberg. And what's really going on, what the real problem is huge, massive. It's that 95% of the iceberg that's underneath the waterline. And so what systems thinking is all about is its tools, its structure, to have conversations, to do inquiry, to bring together our data, to really try to understand that iceberg, what's really going on. So instead of just starting up at the top where we're thinking about that event, the visible part of the problem, right, where we're asking ourselves what's happening right now, what's wrong, what do we need to react to? If we just stay focused up there, we tend to come up with quick solutions that sometimes are just addressing the symptoms of the problem and not getting at the root causes. So we want to push under the waterline. The next level down is getting at patterns and trends. It's asking us what's not just, let's put that event in context, what's happening over time related to that event, but other determinants of that event, what's happening in different subpopulations, what's happening in different geographic areas. So understanding these patterns over time and place and people helps us hypothesize why those differences exist, why those trends and dynamics exist. And if you get people talking about and trying to explain patterns and trends, what you're doing is getting them to very naturally start talking about lower levels of the iceberg. What's the structure of the system and the mental models that are producing those patterns and trends? So when we get to structure, here we're thinking about what's really not just the symptom, but the root cause of those trends and patterns, those problematic ones that we want to change. What's really underneath that? How do the parts of the system come together and interact to produce those outcomes? We'll often hear people say, we're getting bad outcomes, the system is broken. And, the problem with that is that we can't just, often, very rarely do we get to just build something from nothing. We're having to really try to work from the parts, the broad system that exists, and trying to get it to a better place. And so what we really need to be asking ourselves is, why is the system producing the outcomes that we're seeing, right? Why are we seeing these outcomes that we are really unhappy with, that we call the system broken around? Like, what is producing those? Because if we can't redirect the system, if we can't change the structure of the system, we're never going to get to a better place. And so we need to really invest in understanding the structure of the system. What are the components, the parts, and how do they interact? What is it that's really influencing these trends? How is the system responding to other changes? A huge part of this is the mental models that we carry. Different groups, different people within the system, we have different mental models. And what I mean by that is our understanding of the system that we carry around in our heads. It's based on our experience, the data that we've seen, our disciplinary training, the incentives that we feel around us in our job, in our life that affect how we behave. But mental models are so powerful. These are our assumptions, our beliefs, our values, our biases that shape how we respond to changes in the system. So something happens, we respond. We're contributing to system structure in really powerful ways. When you think about COVID, for example, there are so many decision makers across so many sectors that are deciding things that affect health. That restaurant, is it going to stay open? The faith, the church leader who's trying to decide, whether how to keep people connected. In person, socially, outside, keep people connected and safe. EMS, first responders, in the culture, and sort of behaviors around mask wearing. Like, these are all shaped by distinct mental models, and everybody's reacting to everybody, right? Often in a less coordinated way. And we're getting the outcomes that we're getting. And we need to think about how to work this puzzle to get to a better place. Right. But it's in trying to understand what's underneath the waterline that's going to get us to a better place. And so systems thinking is all about really trying to help us understand and develop better actions. Okay, so here's a concrete example. And again, I encourage you to chat in things that come to mind as we talk through this. So an event, a fire, might be that we see in the newspaper, hear a headline like this: Seattle Children's Mental Health Unit filled past capacity amid pandemic. Okay. And so let's think about, if we just see this event and we need to quickly respond, what kinds of actions might people take? The kind of thing that I'm seeing a lot of is just trying to figure out how to absorb this extra demand. What are we going to do to meet this demand for mental health in the ED setting? Do we set up a separate unit, right, that tries to keep people separate and providing access to care? What are you guys seeing? What do you think happens in your communities, when this problem pokes up? How do people react? How's the system responding? Yeah, it's ignored, right? It's temporary. We're just going to power through. What else? What are these quick reactions to this problem? Overwhelmed. Yeah, and that's part of why they ignored often, right? So what's really going on? If we want to push no resources, yes. Some places have put in field units to take overflow, right? I think all of these issues are right. So what's really going on? What's the pattern or trend, right? So we could just focus on trying to solve that problem in the emergency department setting, right? The challenge that we're having about more demand than we have capacity to meet the needs of. But we really ought to think about like what's really underlying those trends. Okay, so what are our national trends in mental health care for US mental health and health care? What's happening? What's really contributing to these trends? So, as we start to think about what the structure of the system is, one way to think about this is kind of thinking about the components, the parts. What are the different service options? How can we try to meet this? First of all, there's an increasing need for mental health support. So why is that going on? There's on the right, we've got a picture of social media and the role, the increasing role that we're seeing social media play in adolescents' mental health, right? And just the contribution of COVID. So there's all these factors that are shaping kind of increased mental health challenges. But then we could also think about the structure of the system in terms of the parts, the services that are accessible to try to offset the need for care before we end up in the emergency department. So what's happening in our schools with our school counselors? What's happening in our communities? Is there access to support for families trying to support their kids? Are there therapists available to support kids when needed? How are we dealing with this? Are we equipping our primary care pediatricians to help, right? So what's the structure of the system, both in terms of service delivery, but also the interconnected factors that are affecting demand for mental health among our kids? And then down at the bottom, what are some ideas about mental models that affect what happens here? What are some examples of mental models that are really important in shaping what happens? So inconsistent vocabulary between stakeholders. We don't really have clear mental models, not shared ones anyway, in terms of how we talk about mental health among kids and what's, what really is, what the service system looks like, what's needed. There are mental models about the role that schools have in mental health promotion, prevention, and how we're identifying kids and treating kids with mental health needs. There's mental models that shape whether as a community we're willing to invest in this, right? Whether our elected officials are prioritizing this. Appropriateness of screening for depression. I'm sorry, there's a leaf blowing right outside my window. I hope that's not too bad. The appropriateness of screening for depression. Who should we screen when, how? Those are mental models. What else? What are some other mental models that really shape what's happening with our kids' mental wellness? Impacts of bullying and social isolation, stigmatization. So here in Illinois, we have a governor who cut a significant amount of mental health services around 2016, and we have not been able to recuperate. Yep, so the compounded impact of an increasing need of mental health services while the behavioral healthcare delivery system has been financially gutted. Yes, right? think that's happening in lots of communities, unfortunately, as a lot of different trends intersect, like deinstitutionalization, underinvestment in mental health systems with COVID. Parental attitudes and awareness about mental health, hopefully that's improving, right? But thinking about, systems thinking is pushing us to have these conversations, to really understand these fires, these events more deeply by trying to bring together lots of different people with different mental models, different understandings, talking about how they see, their stakeholders, people like them responding to this challenge. What can they do? What's shaping what they can do? What's getting in the way of improvement? And it's uncovering these sorts of things together that helps us think about what is really most important about the structure of the system, how all of that sits together, that can really help us improve these trends. And so systems thinking is really all about trying to bring tools to help us have these really hard, really important conversations. Okay, so let's give this a go today. We've tried to put together a really kind of structured causal loop diagramming a template for you that will help you tell stories about COVID. So I'm going to click out of our slides right now and move over to Jamboard, which is what we're going to use to help you all capture stories using causal loop diagramming. This is one systems thinking method that helps us really try to tell stories about the ripple effects and the reasons why we're seeing changes that we're seeing in our community. That it helps us tell these stories so that we can learn together. What is the structure of the system that we want to try to improve? So I am going to follow the link in the slides. By the way, we'll make these slides available to everybody. And I wonder if somebody can grab this. Well, let me make this, let's click on this link. I need to stop sharing PowerPoint and start sharing. Uh-oh. I can't believe all that leaf blowing. I hope it's not too bad, you all. Start sharing. Chrome. Okay. Can someone confirm that they can see my Jamboard? Okay.
Yeah, we can see it, Kristin.
Okay, perfect. All right, so we're going to use causal loop diagramming as it's one systems thinking method to really tell some rich stories, to help you tell stories, right? We want to really hear from you and give you a chance to hear from each other, right? So we're going to ask everybody to make their own causal loop diagram, and I'm going to walk through an example to give you a sense of where we're going and what we want this to look like. So I'm going to talk through this example, and then everybody's going to get a Jamboard frame, and we're going to ask you to capture a story like this one. So be thinking as I talk through this about what you want to focus on. And then we'll go into breakout rooms where we get to share these with each other. And you all will have these Jamboard links so that you can also not just see the stories that that people in your small breakout group make together, but also all of the stories across all of us in this session. Because again, I think it's so important for us to be learning together. So what we want to do, we've got this structured. I'm going to go through this example, and I've got some instructions on the top of each frame. But then we'll have these instructions all together in a slide, which I'll keep up while you guys are off in Jamboard making your own. So what we want to start out with is thinking about, amidst the COVID pandemic, what is a maternal and child health outcome that you feel was really meaningfully impacted by COVID? And really one that you want to share kind of your insights about how, why, and what some innovations or actions that were undertaken in response to it in your community were. And these might be things that you think worked really well and you want to share, or they might be things that you tried and they did not work at all and you want to share why not. So pick one maternal and child health outcome, and it could be a health outcome. I'll have some examples of this later on. It could be a health outcome. Here I'm going to show food security among our community's kids. But it could also be something that's more about how we do our maternal and child health work. It could be, assuring that we have access to high quality and accurate data through the pandemic. So we want to start out with an outcome that you'll write on your green sticky. And then the next step is to really think about, we want to document your insights about How? Why? Why did the COVID pandemic? What about the pandemic and what has it triggered that has led to changes in this MCH outcome? We want to start by documenting your understanding of how this has happened. Okay, so what we're going to do then is ask you to fill in a couple of yellow stickies. In the template, we'll give you 2. You could add more if you want. The way that we add stickies in Jamboard is there's over on the left of the screen, there are a couple simple buttons that you can push. What we would do to add a sticky is just click on the little 4th one down, a little sticky button, and you can add a sticky. You can change the color. So here's another reason why COVID has impacted the outcome. When you're done, you just click cancel. You can move these around. Okay, so 2 reasons why I think that food security in our community, 2 important reasons why I think that food security has been impacted negatively. One is that a lot of families have lost jobs. There's a lot of economic instability. Another reason that I brainstormed and wrote down here was that kids are missing, early on especially, kids were missing school, which was a key stable source of food, breakfast and lunch. And so I wrote these 2 stickies. This is my understanding, in my community of why food security has been such a challenge for our kids. So what you're going to do, you write these stickies. You could have 2, you could have 3. And then the next thing I want to start to introduce is this causal loop diagramming language. So causal loop diagrams have a couple of building blocks that help us tell really powerful stories. The first building block are the variables. That's what we're writing on the sticky notes. The next building block is an arrow. So if a change in one variable triggers a change in another variable, all else equal, we would draw an arrow between them. So if the COVID pandemic triggered an increase in the number of families that have lost jobs. So COVID pandemic triggers a change in jobs, in families that have lost jobs. The last piece, there's the variables, the stickies, the arrows. The last piece that I want to introduce here is this S and O. The S and O, what we talk about, we call this the polarity. It tells us, it describes the relationship between the variables. So if these variables move in the same direction, I would put an S on the arrow. So COVID pandemic increased the number of families without jobs. If the variables move in an opposite direction, I'd put an O on the arrow. So as families, the more families lost jobs, then what happens to food security? Job loss goes up, food security goes down. Okay, I often will stick my thumbs up when I think about this. So the first sticky, lots of families lose jobs, food security goes down. Those variables move in an opposite direction. And I have to be able to read it the other way too. If I was telling a story about, lots of our families got jobs, so families losing jobs goes down, then food security is going to go up. So you're trying to describe the nature of that causal linkage, the nature of that arrow. So the COVID pandemic also triggered more kids missing school. So those move in the same direction. To draw the arrow so what we want to do is draw all these arrows that help us tell the story about what's happening over time. So to draw an arrow, click on the pen over on the left. I have found it helpful to draw the arrows with the 3rd biggest pen. So then you click on that, and then you can draw an arrow right in. Can somebody type into the chat or shout out, what is that, an S or an O? And maybe someone who's seen the chat, could you tell me what? So the more kids are missing school, what's going to happen to food security? Is it going to go up or down?
We have a mixed bag of results in the chat, Kristin.
Okay, yeah, let's think through it. So if kids are missing school, which is a key source of food, so the more kids are missing school, that's going up. Food security, is it going to go up or down? So the more kids are missing school, they're not getting food. So food security is going to get worse. It's going to go down. The way I wrote the variable name affects whether it's an S or O, right? So we just need to make sure that the way you write your variables, that your S's and O's, that they're consistent. So in this case, the more kids missing school, if that variable goes up, then food security is going to go down. Okay. And so to do that, to write the S's and O's, the the third biggest pen is too big, so I go to the second biggest and I'll put a little O here. Okay. So, and what I'm going to encourage, I'm showing you these arrows and S's and O's just so you get a sense of where we're going. But what I encourage you all to do is think through the different sticky notes first before drawing the arrows. We can draw the arrows in later, but I want you to kind of see that we're thinking about stories with arrows like this. So the most important thing is you tell your own stories, get the sticky notes on here. The next thing I want you to think about after documenting how the COVID pandemic has impacted an MCH outcome you care about and your understanding of how that happened, we want to think about on these pink stickies, what's been done about it. So I want you to start to brainstorm here, one idea per pink sticky. What innovations, what actions were implemented in your community to address this challenge? To try to improve that MCH outcome. So describe one action per pink sticky, state, and be sure to say who did what. And the more detail you can put on these stickies, the more your map stands alone, the richer it's going to be to help you tell stories. Okay, so I encourage when you're writing these out, try to say a little bit more rather than less. And if it gets hard to read some of these when you have a lot of text, the sticky gets hard to read, as soon as you click on it, let's see here. Whoops, sorry, cancel. As soon as you click on it, you can, it'll double click on it. The sticky note will pop up and you'll get a real big, really big version of it so you can see. So if your notes get the text gets a little small on your sticky note because you wrote a lot, that's okay. Just if you want to see it, somebody else's, or you want to see your own, just double click on it. It'll pop up big and you'll get to see what it says. Okay, so some of the actions in response to food security among our community's kids might be that the local health department partnered with community restaurants to deliver food to families identified as food insecure. So this was a big strategy in March through summer. Another strategy was that our local health department partnered with schools to identify kids in need and tried to share a lot more information. So contact information was shared with several other organizations in our community that were coming together to try to deal with this, to address needs. And this, the goal was to really help families in need navigate to get resources that exist. And what happened, to really try to make sure that what resources are available were accessible and known about. One last thing that I put on here as an innovation or an action was that our local health department worked with community leaders to prioritize keeping kids in school safely. So really trying to get the kids back in school and keep them there, which required thinking a lot about vaccination campaigns, increasing, in the community, increasing willingness to wear masks and good masks, wear them well at school, trying to come together to make sure that kids had a place to eat outside where they felt safer, coming to school and doing that. Okay, so think about what are these actions. The next step is then, of course, going in and thinking about the arrows, right? So the last piece of causal loop diagrams that I'm starting to introduce here is what we call feedback loops. So when you have a ripple effect, right? So food security among our communities, when that went down, it triggered a bunch of actions, each of these pink stickies. So decreasing food security in our community triggered us to do these 3 actions. So food security went down, the actions went up, right, in response. And the whole point of these actions is that we're trying to address the problem, right? Not a symptom of the problem, but the real problem. And so, and I don't know how well you think we did that, right? It's an important thing to be thinking about and considering. But the first 2 actions were really all about trying to improve food security in our families directly. The last action wasn't really getting at food security directly, it was indirect, which we want to make sure we note in our diagram. So as this last pink action, trying to help keep kids in school goes up, the extent to which kids were missing school went down. And then they had more food security because they were in school. And so there are 2 types of feedback loops that we can create. A feedback loop happens when you have a series of arrows that go around and around and around, okay? Round and around and around. And what that means is that we have an action, 3 of them, that we're putting in place to try to bring balance to the system, to try to make sure that we're maintaining some okay level of food security among our community's kids. Okay, so we're creating these balancing loops that are trying to keep our system in check to protect this MCH outcome, to keep it at an acceptable level. These three actions, and often our actions, right, in response to a challenge, are balancing loops. We're trying to bring balance to the system, counteract things getting worse and worse. Okay, so next thing that we want, the last thing that we really want to think about on the diagram here are these blue stickies, where we want to have you note any other ripple effects. So we did these actions to try to address food security, to improve food security, but sometimes there's other effects of these actions that we want to make sure we document, because these can either undermine our ability to keep these actions going, or they could reinforce it, make it easier. So a couple of other ripple effects that I thought were worth documenting is that we have better knowledge and use of the full range of community resources supporting food security, right? Because we were largely in this middle one, we were really trying to identify kids and come together across our organizations to try to help get anything that was available, you know, to improve outcomes, right? That helped us all appreciate better that breadth of resources available in our community and what the gaps are that we might be able to fill. Also, we have improved relationships between local health departments and schools, right? Because we're working together. That spills over to other initiatives like trying to improve mental health or improve, you know, supporting kids with special health needs and their families in and outside school. So just anything that's really improving this relationship between local health department and schools is important. And I don't know if you all think, you know, in your communities, whether improved relationships have been sustained or if this has been contentious. I think this is an important thing that we want to hear from you. Lastly, you know, the community, and we need to be thoughtful about how we can message on this. The community, the one thing that a lot of our organizations were aligned about was that we want kids back in school. And so the community appreciated our focus on trying to keep kids in school, that was a shared goal. And so last thing we could do is just put in all of the arrows that really help us understand which of these actions triggered the blue stickies and how do these blue stickies affect the system. Okay, so you will have access to my example, but what I really want to do is give you a chance to start to create your own. Okay, so you are going to have, I'm sorry, I'm not sure why that's, okay, so I want everybody to take a crack at creating their own. I think it's great if you feel comfortable getting the arrows in, but the most important thing for you all to start to do is just fill in the different colored stickies. Okay, I want to know what about the COVID pandemic? You know, COVID pandemic impacted an MCH outcome. Which one do you think most meaningfully was impacted? Your thoughts about how this happened? A couple of suggestions about really innovative actions that you saw in your community. And again, the more detail you give, the more somebody reading your map can understand and kind of learn from your insights, and then documenting any broader ripple effects. So with this, I would like to ask if somebody can type the.
Kristin, I'm sharing the Jamboard link now. Should we
Perfect.
just use the first one? I know it says for A to F, but I think everyone can go ahead and use the link I chatted in.
Yes, everybody should use. Yep, we weren't sure how many people would come. So if everybody could go in and grab their own frame, we're going to keep us all together so that as you have questions, ask them out loud, because if you have questions, other people do too, but we're going to all claim a frame, put your state and your initials in the top left, and we're all going to start to fill out a frame together. So, and I want to keep us together that way. If anyone has questions, you all can ask. If anyone's having trouble with Jamboard, we'll go into a breakout group with one of us to try to troubleshoot that. I'm going to also share my screen and put up a summary of the instructions. So if you want to come back and look at that, it will be up. Oh, just one last note. When you think about the green stickies, I strongly encourage you to think about an MCH outcome that you know about. Right? This is going to be hard if you're not telling a story that you know. So if you have a thought about an MCH, like a health outcome that you're comfortable, fill it in. But if you don't work if you're not working directly on health outcomes, you might want to put a green sticky related to assuring that maternal and child health data remains accurate and up to date, or ensuring the sufficient MCH workforce, or stewarding state resources toward pressing MCH issues, or something like that. So feel free to get creative with your green stickies. This MCH outcome can be health related, or anything that you feel like you can speak to that you really want to explore. Okay, and then here's a summary of all of the instructions. What I would encourage you to do is start by working through 1 through 4, which is really just brainstorming and filling in the green sticky, the MCH outcome, the yellow stickies, your thoughts about why COVID pandemic has impacted it. The pink stickies, which are some examples of actions or innovations in your community that you've seen in response to the threatened MCH outcome, and be clear about who did what. And then the blue stickies, any spillover effects. So let me pause. Feel free to type any questions into chat or unmute and ask out loud.
So we should just write our names into one of these slides,
Yep.
correct?
Yep, grab
Okay.
one of the frames, claim it, and start brainstorming in there. We're going to give you about, we'll see how long it takes to fill them in, but a good 10 minutes to try to brainstorm your own frame, and then we'll go into some, we'll share some of these with each other. Okay, so I want to make sure if anyone's having trouble getting into Jamboard, let me know. And remember that the instructions are available over on Zoom if you want to come back over there. So I want to make sure that everybody's getting into Jamboard okay. It looks like. So is there anybody on the call? Please unmute and speak up if you are having any trouble. We want to help everyone get into Jamboard and give this a go. I also just want to make sure that everybody feels comfortable grabbing a template and just clicking on whatever they want to edit. Double click on the text you want to edit and just type in what you want to replace our questions or prompts with. If anybody would like to be doing this in a small group, we can also send you into a small breakout group room. Okay, it looks like maybe only 2 people are doing this. Do we want to try to do it together?
Sorry, I'm trying to log on, but just my computer is not cooperating at the moment.
No worries. Let us know if we can help you work through that. I am happy for us to do this together, do a couple of these together.
Kristin, I think that will work as long as people are willing to either chat or come off mute, and you can run the sticky notes.
Yeah, let's do it.
And there's actually, I think, a couple that are started. Maybe we could just work off of those 2. People can join those 2 in a big group discussion.
Yep. Okay, so we have prenatal care visits decreased. And we have mental health outcomes during pregnancy and postpartum. Does anybody want to vote for one of those? Do either one. And then I also see routine childhood vaccinations. Let's do mental health outcomes during pregnancy and postpartum. So this is frame 7. Let me share this screen. Okay. Okay, can everybody see my screen?
Yeah, looks good.
Great. So, okay, so we're together on frame 7, but if you just want to come back to Zoom where I'm screen sharing, we can type in here and talk through this. So the outcome that we're going to focus on is mental health outcomes during pregnancy and postpartum, which have been threatened. So let's think a little bit about what are the different reasons why? Why do you all think that this has happened? What specifically underlies this? Feel free to unmute and just shout out, actually.
Maybe not to put you on the spot, but I know we hijacked your idea. If you have any thoughts on this to share,
Yeah,
take your topic.
sure, for sure. I was thinking increased isolation.
Yeah. Yes. Okay, what else?
Put one in the chat, Kristin. Restrictions on support people during prenatal care and birth.
Restrictions among support people?
Yep. Yep.
And what are some examples when we say support people?
I think those are, people who would have been with the person having the baby during delivery.
Is that like friends and family, or is it like more formal roles, like doulas?
Both.
Okay.
So some delivering sites only allowed one person. If there was a time when nobody could go during delivery.
Yeah. Okay. Any other important reasons here? What about how we would normally support mental wellness of among our moms? Are there any, or if who's checking for depression and what kind of services are available?
Yeah, that was the other thing that I wanted to add was, I don't know how you want to frame it, if it's like there's an increased demand for mental health services. Like I know that like waiting lists were getting longer. So we could either say that the waiting lists are getting longer, or we could say like decreased accessibility.
Yeah. I think that the waiting list getting longer leads to, right, decreased accessibility. Yeah. Okay. I think that's, yeah, great. What else? Are there any other reasons for this that we want to document here?
Dorothy put one in the chat, stress over decisions about receiving vaccination during pregnancy and general concern about whether the baby would get COVID. I was thinking something similar to Kristin about the general chaos and stress that COVID and like threat to your safety that COVID imparted on people.
Can you say the last thing one more time, Jess?
Just the general stress from the pandemic and on people's safety over and well-being overall, the chaos it caused.
Yeah. Yes. Great. Okay. Yeah, I think it's really important to really understand the why. So there are some things about COVID just being generally stressful that are negatively impacting mental health. There's also just the impact of isolation is leading to stress. Okay, is there anything else that feels important and missing? Okay, so I'm going to start to draw some arrows in here, and I'll explain kind of out loud how I'm doing that, but I want you to begin brainstorming what are some innovations and actions? What have you seen happening in your community that is trying to address this, the decrease or increasing mental health need for women in the pre and postpartum period? What are some of the actions? Anyone that wants to go to this link can actually go and start typing in, or if you want to drop ideas in chat, we'll type them in.
Kristin in the chat talks about telehealth, mental health services being approved for payment as an innovation.
Okay, Jess, could Jess or Izzy, could one of you go into the
Yeah, I can do that.
and start typing some of these in? That would be fantastic. Okay, so we're starting to type in some of the innovations and actions that you all are thinking about in chat. Feel free to add some more. You look at what's missing. I'm trying to put in arrows to kind of explain what's going on over on the how is this outcome impacted side. So the COVID pandemic is affecting stress about stress, in part stress around specifically decisions about to vaccinate, et cetera, which perhaps could be helped if, and I drew an arrow from isolation. If there was less isolation, perhaps that would help this outcome. Maybe I shouldn't have drawn it from isolation to this stress about kind of whether or not to get vaccinated. Maybe it's this, the restrictions that make it harder for healthcare supports to be seeing, that could maybe help answer questions. I don't know. We need to be thinking about like, what of these things interconnect? So the COVID pandemic, the way I drew it was that the pandemic is leading to stress, specifically about vaccination, which is contributing and adding to just this overall stress. And stress is, the increased isolation is making the stress worse. But just because there's higher levels of stress in the community, people are feeling more isolated. We're not checking in on each other as much. We're not, I think that I think there is a little bit of what I would call a reinforcing loop here, where just the level of stress in the community is leading to more isolation, and isolation leads to stress. So the just increased levels of stress, restrictions among our support staff, the increased waiting lists, right? The more stress. I probably need to draw an arrow from stress in the community down to the waiting lists for people getting services, right? The more people are stressed in the community, the longer those waiting lines are. And the decrease in access is just negatively impacting mental health outcomes. So I'm going to start to put some of the S's and O's on these arrows. But again, what I'm trying to do when I connect these variables is show you my mental model of how I'm thinking about this. And you all might want this to look different. So feel free to type any thoughts you have about any of this into chat, or unmute and say it out loud. Waiting lists get longer, mental health outcomes go down. So this goes in the opposite direction. The COVID pandemic has increased waiting lines, so those move in the same direction. COVID pandemic has increased restrictions, increase in restrictions, increased isolation, so that's an S. Increased restrictions leads to a decrease in mental health, so that's an O. Increased general stress leads to more demand, leads to longer waiting lines, so that's an S. COVID pandemic has triggered increases in stress, that's an S. Isolation triggers stress.
For all the yellow stickies, are you supposed to call out all of the things that are like negatively impacting your outcome, or should you say like things that could have potentially positively impact that outcome?
Yeah.
Those go in ripple effect or in the yellow?
Yeah. So again, we kind of have these different colored stickies just to help tell the story, but at the end of the day, they're all just things that matter. So I think if there's something that has changed triggered by the COVID pandemic that positively impacts the outcome, you absolutely want to capture it. With the ripple effect over in blue, what I was really thinking about over there is making sure that we capture any, all of our actions, they have the intended consequences, right? The reason we're doing them, but often they have additional spillover effects. Sometimes they're good, sometimes they're bad. That's what I was really trying to get you to think about with the blue stickies. Tell me what you have in mind and we'll figure out how to integrate it in here.
Yeah, I guess I was thinking, and it just depends on like your class and the type of work that you have, but I wonder if like the isolation could have also, like, once we went to like full lockdown, every extra thing you had going on kind of went away, right? So for like a parent or a pregnant person that's like super busy, got a lot going on, now it might have allowed for like more time to just focus on, your pregnancy, or, just kind of taken away a lot of like the background noise that might have also potentially impacted your mental health.
Should I say, how do you want me to word that? Simplification of like life, or?
Let me see. I think Dorothy made a comment. Yeah, work-life balance, I think, is a good, simple way to say that.
Yeah, and I think for some moms that probably got better, and for some it probably got worse, right? So I think this is where it's probably important to really spell this out. If work got harder because everything had to suddenly keep happening, but from home, and then you've got your kids at home, other kids at home, right? Like that. We want to make some of these notes. So work-life balance. So it could improve if life is simplified, if like out-of-home tasks.
I think we heard that people found more time in their day because they weren't commuting. Commuting in itself is stressful, but then it also provided more time. And clearly these impacts are not, I just want to make the point that they're not the same for everybody. So while, some populations may have been able to get in-home care for children, I heard people, set up classes with their neighbors so they could rotate days when kids were in class together at home. I mean, it just really depended on what your opportunities and your privileges were, whether it became better or more difficult. So just to make the point that it's hard to like see the equity or inequity impacts in models like this.
Yeah, and this is why it's so important to really get pen in people's hands and have you all tell your stories, because I think everybody's experience of this is slightly different. And if we want to understand kind of how different families are faring, what they need, how our different programs are responding, and how to get that are aligned, we want to really hear kind of all these different stories and kind of sit in the middle of it and figure out what we most need to do. Our time has really flown together, so I want to so we could keep brainstorming, keep adding. And one thing that's lovely about doing diagramming like this is that you see what is what's getting added and what's missing. It's nice to be able to see what others are thinking, what we have in common, and what's missing. So I'm looking quickly at some of these actions in response to this. Again, part of why it's worth brainstorming the yellow stickies, the kind of understanding and talking out loud about why this has emerged as a challenge, is that it gets us to think about like what else we could be doing. So when you look at the actions, the pink stickies that exist, is there anything that you all think could be added that responds to something in the yellow stickies that isn't there now? Oops. I'm going to turn on the pen and just make some of these arrows. The worsening outcomes triggered all these actions. Okay. And how the outcomes get worse, these actions go up, so they move in an opposite direction. Now let's make sure that we're thinking through and documenting what these actions are doing. So the expansion of behavioral telehealth, what is that getting at? Which of these yellow stickies is that getting at? Is it getting at the wait line, the waiting time, the access? I think so, right?
Yep.
Okay, now this is why I encourage us to think about the stickies before drawing arrows, which I totally didn't do. So right now this is at the top and I want to point to something down at the bottom. So we're about to get really messy. There's software that can help you do this without, like while moving around. The arrows aren't hard drawn. You can kind of move things around. So I'm sorry that this is getting messy, but I want you guys to get a feel for how these diagrams are built and the stories, how we're trying to tell stories with them. So the telehealth goes up. The waiting lists go down, these move in an opposite direction. And we've created a balancing loop to try to improve our outcomes. So COVID is through increased demand, increased waiting lines, decreased access, which has negatively impacted mental health outcomes. One response is that we're using telehealth services to really try to address, get rid of, deal with the waiting lists and our challenges with access to try to improve outcomes. So that's a balancing loop. We're creating a system, a feedback loop here to try to control, bring balance, get our mental health outcomes at a level that we feel we want to see. So the telehealth support services, home visiting and things like that, what is that really getting at? Is it increased isolation?
I think for us, it's more about the restrictions amongst having support people. If you can have telehealth services, then you can at least, talk to somebody and not be totally alone.
Yeah. And part of what's really good about having this conversation and having you answer that way is if we're deliberate about like what we're doing and why, we can make sure that that's happening, right? That we're really prioritizing that. And we could also think about while we're at it, is there something else we could do? Could we try to use that to address this challenge with our moms feeling isolated? I love that. Any other thoughts about that one? Expansion of postpartum Medicaid coverage. Love seeing this in a lot of places. What's that all about? access to care probably, but not just the waiting lines. That we're probably missing a yellow sticky, which is just really getting at like the ability of moms in the postpartum period, right, to retain access to mental health services. So I might kind of write that in, but this is getting at, this is one with some nice spillover effects. And we could keep going, trying to draw these arrows. Can anybody suggest, when you look at these pink stickies, are there any blue stickies, any ripple effects that we think are important from any of these activities that either would make it easier for us to keep them going in the future, or that might threaten our ability to keep doing this?
So I would say parity of coverage for behavioral health services and primary care. I know we've been working on that issue, and we have this like egregious example that there's one FQHC that shared with us that they get, I think it's like a 33% coverage. So I think that like for like a primary care visit or like it's like $150 per visit. But for behavioral health, it's like $50. So it's not a financially sustainable model. And so they always will operate at a loss.
And do you think that, and did something in here help that? Did the expansion of Medicaid coverage help that, or is that going to exacerbate that problem?
I think that what does help it a bit is the top one, because of that CMS policy that like right now there is some better coverage of like behavioral telehealth services, but that's not permanent. So I think that there's folks trying to build evidence that, you know, it should be a permanent change. So that's like a layered issue that, you know, right now we're allowed to do both virtual like visits and telephone visits and get coverage, but we don't know how long that will last.
I'm going to make a note here. That's really the kind of thing that's great, but it needs to be more, you know, permanent. Okay, that's great. Calling out when, you know, some of these fixes are threatened or what needs to be worked on to kind of really sustain these gains is so important. Okay, this is great. Good job. I want to go back to the slides and really just kind of reflect a little bit more about why we do this and what these conversations, you know, more advanced versions of this can start to look like. Does anybody have any last thoughts of this before we turn back to the slides though?
I think it's worth just noting Amy's comment in the chat if you haven't seen it.
Can you read it out, or Amy share?
Amy, can you read it or describe?
I'll go ahead and read it. When making diagrams in real life, we'd have everyone make their own diagrams, then describe them with a group of stakeholders to elicit these types of differences, and then think about how that might impact our choices about interventions. Which of the innovations are highest levers for action based on what we learned from all of the stories?
I love that. Yeah. And so here, kind of getting at this, Izzy, do you want to take it away here? Do you want to talk through this?
Sure.
Expand the comment, go for it.
So one of the values of this causal loop diagram approach is that it really allows us to get at the different levels of the iceberg model and allow us to map out not only the structures, but the mental models that really perpetuate these systems that lead to patterns and trends over time that we see as problematic, and these symptomatic events that really call our attention. So one of the roles that we saw for this exercise was to allow us to dive into some of the COVID responses that the maternal and child health workforce has initiated, and think about which level of the system they focused on. As we get deeper into the iceberg levels, there's often a lot of opportunities for levers that will have better long-term impacts on improving system outcomes. But there are also challenges that come from considering these other levels of the system. And I think, as we saw in that example, sometimes it takes a lot of conversations and it takes getting messy before we really sort through the variables and the relationships among them and define the system. But in doing that process and getting to a point where we have really explored these different levels of system thinking, we've really found that this approach can allow us to make informed decisions that are really targeting the true root cause of issues we're seeing in our system. So if you'll advance the slide, Kristin. Before we end today, we just want to really briefly put this exercise in context of the larger method of system dynamics modeling. Next slide. This is an approach that has been around for many years. It's more recently coming into the field of public health and health services, but it's a decision support modeling approach that really allows us to explore the systems of the structure of systems and these mental models of the stakeholders involved in your system. One of the really unique features about this approach is that it allows us to capture these nonlinear relationships between parts of the system, sometimes called feedback, as Kristin was pointing out, or endogeneity. These are sometimes hard to capture in other modeling approaches, but they really reflect what we see in the real world environment, especially among the maternal and child health workforce systems. Next slide. The approach that we used today was causal loop diagramming, and it really falls under this first category of qualitative diagrams that system dynamic methods offer. There are also two other approaches known as concept modeling and then tested and analyzed modeling, that the three together fit into an iterative process. So we wanted to just talk about how you might further develop your causal loop diagram models and show a couple of examples that we've found actually in the literature of individuals from the workforce really putting this into action to address persistent maternal and child health problems. So qualitative diagrams are what we've just walked through with causal loop diagramming. They are often developed collaboratively with stakeholders through a process called group model building, and they have been found to be particularly helpful in facilitating conversations on complex topics with diverse stakeholders. I think as we saw today, they have an end deliverable that is useful, but they also facilitate a process that is incredibly helpful for understanding all of the competing variables that we must consider when thinking about responding to problematic events or trends in our work. If you'll advance the slide. Concept models build off of qualitative diagrams by starting to introduce some numbers and data to really think about how to quantify the relationships between variables that we've identified and to start to play with the system a little bit. They give us an opportunity to pick outcomes of interest and see how changing the strength of relationships or the parameters in the system might change the patterns of outcomes that we're seeing over time. You aren't necessarily worried about having perfect data in this iterative step. Instead, you're really just using this to explore the system and test out hypotheses about how the system responds to change over time. Next slide. The final iteration of this SD approach is a formal tested and analyzed model. Now, this is, the most sophisticated iteration of this method, where we traditionally will use historical data to calibrate the model and build our confidence in the accuracy of our model in describing historical changes over time, so that we can then start simulating models to project future trends. Next slide. At the Maternal and Child Health Workforce Development Center, we've really seen a lot of value for introducing this method into the maternal and child health workforce. And so one project we've been working on to better support utilization of this approach amongst maternal and child health workforce has been to systematically search out the literature to find all applications of system dynamics applied to maternal and child health topics, and really inventory and learn from how others in the field have utilized this tool. So in this search, we were able to find 101 published articles that applied to SD methods. Next slide. And when we mapped out over time how many publications have been distributed, we're really seeing some exciting growth in the last several years, where this is becoming more commonplace to use in the field and to talk about in the research literature. It's also really exciting to think about the breadth of topics that we've seen covered in this literature that span anything from developmental disorders, immunization, childhood obesity, smoking and tobacco policies, neonatal mortality, homeless youth policies, asthma management, and really so many more. So just quickly to end, we wanted to briefly show you an example of each SD approach from a really nice example in the review. So the qualitative causal loop diagram on the left shows you how using software a bit more sophisticated than Jamboard, but still pretty user-friendly, can allow us to really depict these system structure relationships across variables that are surrounding a problematic trend or a symptomatic event that we're seeing. So in this paper and in this example, a causal loop diagram was used to facilitate conversations among stakeholders in the Salud Mesoamerica 2015 initiative to really think about the impact of limited staff and clinic capacity on the outcome of interest, which was getting children vaccinated. One really important note that we saw from that paper was that when using the causal loop diagram approach to facilitate these conversations, stakeholders began to shift their focus from whether one person is right or wrong to instead discuss about whether or not the diagram is correct and whether the diagram captures the relevant relationships, resolves a conflict, etc. So again, the process was as impactful as the deliverable. Next slide. A paper from a group of researchers in Georgia showed how a concept model could be used to really engage the state legislature in discussing the impacts of policies on childhood obesity. Georgia policymakers were able to choose the topic of this model and were able to interact with the model in a learning lab setup to experiment with the impact of different policy options on reducing childhood obesity. This was an informative process and had a really exciting outcome of actually supporting the passage of a bill that proposed a unique combination of interventions to prevent childhood obesity. Next slide. And finally, in a more sophisticated model, a tested analyzed model was built to really study the complex relationship among stressors, rumination, and depression in adolescents. The authors actually collected their own longitudinal data from middle school students and then used this data input into a systems dynamic model depicted on the far left to simulate the evidence of on impact of prior stressors to current levels of depression for adolescent populations. This really allowed them to better understand the feedback between the variables of stressors, rumination, and depression, and actually test out some simulations where they looked at the average time adolescents ruminate after activated by a stressor and the corresponding levels of depression associated with different lengths of rumination. Next slide. I'll turn it back over to Kristin to end with a brief discussion on this COVID model.
Yeah, so I'm linking here an example of a system dynamics simulation model that was built to really inform understanding of COVID in a community. I'm giving you this one, even though it's an early model. not our most accurate current model, because there are some, it's available, it's freely available using the link up above. You can download the model, and there are several video tutorials where you see how it was built up and how you can interact with it. But what's really nice about system dynamics as an approach is that it really is meant to try to open that black box. So as we start to build up models, right, based on our understanding of the system, and here it's really focused on this idea of how our population flows between these disease states: susceptible, exposed, infected, recovered, and our estimates of the parameters that shape that. But what it's nice about SD is that we tend to also try to build into these models ways in which response to the system impact outcomes. So right here in the center, we see public health strain. So the more people are infected, the more public health strain. And that gets at our ability to really support isolating infectious cases, things like that. So I just wanted to make this available, this model, just a screenshot of it real quick available, because I think it's a great one to play with. So you can get a sense of, when you download this model, you can click controls, and you'll also get a dashboard that takes away some of the the sort of details of the model, and allows you to focus on, if you play with sliders, if you move sliders that we can impact with our actions in community, you get a sense of how COVID outcomes respond. I've built models like this, real simple models like this that represent our best understanding of COVID transmission in settings like schools and universities, church communities, where we try to make better decision-making, to really inform better understanding of the COVID dynamics and better decision-making and commitment to decisions within organizations, for example, considering different masking policies. So I just want to make sure that introducing this idea of how these types of models, which are not inconsistent with other SEIR type models, can be used to really inform our discussions about COVID. Happy to talk with anyone who is interested in learning more about this. And with that, Izzy, do you want to close this out, or do you want me to?
Go ahead, Kristin.
Okay, so I just want to thank you for your participation and time with us. We have a lot of resources available. This is the tip of the iceberg. And so don't hesitate to reach out to either Kristin or to me or Jess. Emails over here on the right, and we can get you in touch with any of us at the center. There are also lots of references to systems methods available on the MCH Workforce Development Center site, linked at the bottom. And then we've got videos and tutorials trying to really introduce a variety of other system mapping methods that we use in our toolbox to really help collaborations and communities have better conversations to really strengthen our impact to support maternal and child health. So please feel free to look around at resources. Don't hesitate to reach out if you have more questions. Feel free to drop any questions into chat, and thank you very much for your time with us today.